Now, I would like to introduce today's expert, Dr.K. Shrikanth sir, who is going to throw light on the topic optimizing daily outpatient practice through simple Panchkarma procedures. Dr. K. Shrikanth is a senior Ayurvedic physician, Panchkarma specialist, and CRAV guru with over 33 years of clinical experience. A BMS graduate from Ayurveda College, Coimbatore, he underwent traditional Guru Shishya training and advanced Panchkarma education under eminent Ayurvedic mentors. He is the founder of Abhay Chikitsalaya, Kollur, Karnataka, where he provides classical Ayurvedic treatment with expertise in Panchkarma, Vatvyathi, Hridrisi, and migraine management. Dr. Shrikanth has mentored over 25 Ayurveda doctors, treated more than 300 international patients, actively promotes medicinal plant conservation, and currently serves as president of the Eco Development Committee in Kollur. Now, I would like to invite Sir to proceed with the lecture. Thank you, sir.
Namaste. Can I audible for everyone?
Yes, sir.
Okay. Sri Dhanvantaraya Namaha, Sri Mookambikaya Namaha. Today I am presenting a webinar about the optimizing daily outpatient practice through the simple Panchakarma procedures. First of all, I thanks to all of you. First of Vaidya Devendra Trigunaji and Vandanaji, Prakash Kuteja, and all team of the RAV, plus all senior gurus. Also, my dear students. Especially, I have to thank to Dr. A.R. Acharya, now presently Shalyatantra Guru in Udupi. He was teached me the Ayurvedic practice in 1993. So I started my practice in Kollur with a OPD level Panchakarmas. Then I built my hospital, Abhaya with Chikitsalaya, with IP patients. We are treating all of which curable in Ayurveda. We treated, we succeeded. So many result came with the good result of the Ayurveda. So I am like to present my sharing knowledge with you all. Thank you. So first I will start why this is Panchakarma needed. See, all the students outcoming, they are known, especially when the Shamana Chikitsa, they go for a clinic, they do the starting with the Shamana Chikitsa. But importance of Shodhana Chikitsa, as per Ayurveda told, we have to do Shamana Chikitsa, then only Purna Chikitsa will be there. For Shamana Chikitsa, we need the for Shodhana, we need the Panchakarma treatments. That cannot be practiced in a high level of a beginners with a big hospital, lot of investment. It's not possible. They should start in a low levels to Panchakarma in a OPD basis. So that is my topic today, to help the students. Now, and RAV Guru's direction needed for that. So all the students, I require all you start with your treatments, what specialization that, but Shodhana karma is necessary for the balancing the dosha, and Rogana Apunarbhava or Roga Samuha Vimuchyati. These are the precious thing in the Shodhana. So we start with our presentation with now what is the possibility of the needed for a OPD level. So I'll start my thing. So first of all, it is a patient convenience based. Patient all are not affordable for going for a IP treatment, or they have time limit is there, they are working, family burdens, these are all that. So patient convenience is very important. So patient will easily come to the OPD patient. That is, OPD allows the patient to receive the treatment without getting any admitted. So they can continue their work, studies, and household activities. This improves the treatment result also. They get follow-up very easily. So it is useful for working professionals and some elderly people also. But there is time limitancy there. Time efficiency it will take roughly half an hour to 1 hour in a day. So you can take 1 or 2 patients in your OPD basis in the morning or section, evening section. Like that, if you do, you can succeed with the management time without affecting your OPD level treatments, OPD practice also. And it is also doctor-patient relationship very easy because they can uh, get their working hours efficiency. There are such things are very good for them. And waiting for timing for the patient, it is not so much necessary. Or timing adjustment also. Morning, early morning, we can have the treatment, then go to the OPD, then evening some sessions we can do. So 1 or 2 patients in OPD level, if you start, it will generate your practice well. Plus, it helps to the uh, basics of the Ayurveda to promote the in a places there. And the economically also is good. In a IP, you have to expense must will be there. Lot of all charges will be more. When it is in OPD level, in a minimum charges. So it can be say it's in a, my hospital is in very rural area. So rural people can afford for that. They cannot afford all the patient to come to the IP. So it is economically it's good. Hospital requirements will be less. It makes Panchkarma affordable for every person. That is our intention. Ayurveda should reach for the ultimate to the poor people also. That intention can be done with the OPD level. Then minimal requirements. For a hospital requirement, you need a big set. Beyond that, now hospital rules are very strict. So many rules and regulations which not affordable for every student to achieve that work because all fire safety, STP tank. This is a large investment for the rather than a practice. Other things we have to invest, and it's a rules and rules and KPMP rules are very strict with the hospital. So you can start with OP level, then daycare centers you can do, and you can practice the Ayurveda very well. And it makes Panchakarma accessible to the all the people, and it's a one intention. Next, we can say rules, as I told, rules needed, all a lot of paperwork for the hospital. In the sense, in the hospital, one benefit is that we are achieving the insurance, where now we are request to have the OPD basis also insurance is needed. Then people will have more Ayurvedic treatments and uh, and hospital beds will remain for the who are serious patient, we can remain the bed. Sometimes in hospital you cannot get the bed, they are waiting for the bed. Then we can OPD basis if you do, it can benefit to serious patient to get the thing. And normally bystander is not needed for the OP patients. Just they come and go. They without any bystander, their timing will be saved. They can go for work. These are the benefits are there. But there is a limitation for the OPD also. So there is observation will be less. When I say IPD, you can have the patient counseling very well. You can deal with his. There is one principle we can have Putravat Samapachare. You can take his in house like a very good observation. But in OP patient level, just they come and go. Sometimes their risk will be there after going home. They will have some apatya or what doctors advise not followed. Then it is IPD's benefit for such a patient. The complications comes there, then we have to run to his house, or sometimes it is a some complications may chance in the observation level. And some the Purva karmas, for example, Vamana, whether they have taken Purva karma food, Utleshita karma, that's and all, or they have not taken proper Snehapana, this all will problem will be the OPD. But you can manage direction to the patient very keenly, observing the patient and tell him to how to follow. If a good following patient, we can do in a OPD level all the treatments. This I will tell you later how all the treatments can be done. And routine, they will have, see, I have tell you go and don't do any work, heavy work, traveling, or go to sunlight. These things, they whether they do or not, we cannot know. When they are in hospital, it is good. Next is the coordination gap. There is a coordination between doctor and the therapist. All this coordination gap, or what I told, he used to come at 6 o'clock or 7 o'clock. He will come 8 o'clock. Then there is the problem will be there. So that problem can be avoided in IP level. Sorry. 1 minute. Then Divasopna should be there in IP. We can avoid them with engaging them. But after Abhyanga, or they will sleep in the home. That we cannot communicate very well. That will sleep. Divasopna will be giving adverse effect after the being treatment. Then they will complain your treatment is not so good. Treatment is not effective. They say that's the name of the Ayurveda will go. So better. At the end, I will tell always IP is better, but OP is because of these economy or such things we have to OP is my intention of the OP level treatments. So next is some clinical quotations will be there. Quotations is not every patient suitable for OPD Panchkarma, that we have to know. He have to lift, he have to bring in a wheelchair, and all that is not possible. Severe illness that needed, when they are very severe, some backache, they are coming, they are not able to move, then we cannot advise for a OP level. And proper selection of the patient, which is essential for him, or whether it is needed OP or IP, that we have to decision. And the safety for the over-aged people, we cannot them to come to the OP. If it is OP is in upstairs, then it's difficult to come. So that is all this thing. Overall, I say IPD is always best. But here I am explaining how can you manage the IP treatments in the OP level. First, we can need the setups. For a setup, we need mainly on drone or a table. Treatment table, massage table is very important for this thing. It is a wooden, is always best. In our hospital, we will take the next Vomika or Vishamusti wood. Vishamusti wood, what effect I have seen, our Visha is the Jangama Visha, is the Stavra Visha is the Vishamusti. So it is a balancing the body also. It Vatahara. So you choice if it is there any wooden tables or anything, it is good first. Then fiber table. Fiber table cleaning is convenient, and but it will slip so much. If you do any Padabhyanga with the patient, you will also sleep, patient also will sleep. So very careful with the wooden fiber table. Then procedures all needed. For that, we need a Panchkarma treatment room. Panchkarma treatment room, in a minimum basis, you do Panchkarma treatment attached with the washroom, because we need a washroom. Unless it is not possible, the Panchakarma cannot be done. So washroom is a must in that. It is with the toilet. It is helpful for the giving basti and all. And in that room, need a small rest room also. If it is a patient can rest for 1 hour, 2 hours, for some karmas, they need to stay for half day. Then you need a rest room also. Then it will be useful for that room. Another, any electric or gas stove connection. This fire is very important to for any karma. We need the fire. So you need a stove or any electric stove also. In Upakaranas, we can have some pots. I will show you some, because I have changed my principles of the pilichil with a pot. I'll show you here a pot which can be made a hole. And hole, you can do it. I will show the later picture. Show the Tailadara can be done like this instead of squeezing in the cloth. It will be useful for our hand, and it is nice to give massage with another hand. So it is that is necessary. And syringes like Matra Basti tube, we can give the glycerin syringe, which is useful, very useful for giving Matra Basti, not Sneha Basti. So it will be given 100 ml, up to 100 ml, we can give this syringe. It's very easy to introduce this. And Natsya dropper and Shirodhara stand and pot. instead of stand, you can have a rod on your table. Straight above the table, you can have rod, then you can hang the any Shirodhara pot, any Dara pots, or any, if you are doing Padabhyanga, you can hold on that. So you can arrange a rod on that and with hooks, then it will be useful for the treatments there. And Vasti, rings. I have made some rings very easily. For example, Kati Basti, this is Janu Basti, you have to cut like this, then you can fill it, then just little Masha Kalka is enough for that. Round rings for the our Kati Basti and all. And Shiro Basti and all, we can have a papers like this that is available in the market. This paper can be folded to the size of the head and you can gum it, then you can do the Shiro Basti. So Shiro Basti rings and cotton, gauze, and this for removing the oil, the knife, so we can have a sponge. Sponge is good to remove the oil, and scrapers, some scrapers which will be, you can see the name boarding, they will have the scrapers where we can collect it. That will be good for the removing the oil. And towels, blankets, or you keep for extra towels needed. Whenever oil is lot of oil, to clean that towels and cotton things or any now the wipers come to remove the oil, that are all useful. And kidney tray, measuring cups, and in diagnostic basis, we need a thermometer, BP apparatus, stethoscope, and first aid emergency kit, because we can get any time Atiyoga or any complications comes in the treatment basis. So we can avoid that one. We should have always with the medical emergency kit. Oh, yes, next. So I hope I will show gas stove, a Duma Yantra. This is Duma Yantra is nicely, we can give this Duma Yantra. I don't know whether it is. We can keep the Duma here. We can go. It will be very easy to go. Distance will cover. Duma can be protect your eyes and all. So it is good for the giving. Shirodhara, you can mud pots, you can use with a hole. You can just ring, you can put, and you can hang what I told in the middle. There is a one rod. If you put on the top of your droni, then it is useful to hang there. Anywhere you can move, even if you want to dara in the body also you can do. In dara of the body, is there anything? I have made a one long pipe. Then if you centrally you put, you can whole body, we can make in a kashaya dara, dhanyamla dara. These are can be done in the single, because here we can less the labors. The labors are now difficult to get. So we have to need some labor. Depending on the labor, we have to use some techniques to reduce the labors. Next place. And for this, the specs can be used for a covering when nasya. You can cover the patient's eyes and when you give Swedana for the face and all, you can avoid this. And you can, this will be even Shirodhara also, you can put, the eye can be protected from the oil. So this will be very useful. Same thing you can give for make a hole, then you can do for the Tarpana. This very easily you can do Tarpana. You can remove from the syringe, or you can put the syringe or small spoon, you can give for a Tarpana. And the steam, you can just have a cooker with a pipe. You can give local Nadi Sweda, or in the steam yantra, you can put this one. If there is no steam yantra, you can have now pumping steam yantras came. Otherwise, you can put a blanket on his shoulder, put the steam in below the chair, then you can cover. So in OPD, sometimes we can say take Swedana in home. So you can do, if there is no yantra, Swedana steam chamber, you can use this one also. And the long cups we need for any treatments. Long cups are can heating oil indirectly. It is useful. So long cups vessels are needed for our treatments. So all in, you can OPD level, you can keep it for that. See, this I told you. You can dara on the top. There is a one rod you can put, and this pipe can be folded to the from the neck to the up to there. In this, any kashaya dara or dhanyam dara, one labor can do with the help of one heating person. Even if you emergency, you can one person also can do with little difficulty. And Agni Karma Shalaka, you must keep this Agni Karma give instant relief. So Agni Karma can be proceeded in the OPD level or burning some wort and all. It will be very useful. Agni Karma Shalaka. Then procedures. In that, I will tell you two type of procedures. One easily we can do in OPD level. With effort, we have to do other things. So in the OPD level, first, all these karmas very easily we can do. Out of that, Jalukavacharana karma you can do in OPD level. Ask them to Pura karma, you just ask them to Peya or Ganji after taking. They come in the after food, they can come around 12 o'clock to 1 o'clock, mid noon, they can come. Jalukavacharana take 1 to 2 hours with the preparation of Jaluka should be ready with you, and put them into the turmeric and sarshapa jala. Then you keep it for a 10 to 15 minutes, then cleaned water. Then you can procedure you can do. Pradhana karma you can do. After Paschat karma, you Pushyanaga churna or any Yashtimadu churna, tie it up. You can bandage it because otherwise they have to travel. Any traveling, sometimes they may bleed because of Jaluka. It will take 24 hours to stop sometimes. Even so, bandage and send it there. And cleaning Jaluka is very easy. No need to squeeze and all. You try with a little salt water with turmeric and warm water. It will expel by itself. Don't want to squeeze. We are doing that one. So it is helps to Jaluka to not completely emitting, little emits, and it can live long that they will. So keep that one after keeping, date it and keep it after 6 months. You can reuse the Jaluka also. And Nasya can be beginners. I tell Nasya process you do. That is simple. Start the Panchakarma with Nasya. People will get lot of no allergies are there, manyastamba, sitting in the computer, lot of screen disorder and headache, sinusitis, all cases will normally come to the OPD. Then give a Nasya. Then lifelong they will remember your treatment give me result. No headache after your Nasya. Such talks I have had so many patients because this is very simple process. You can, it is simple in the sense you should be very careful. Ask them to Purva Karma, you don't need too much Purva Karma, but don't take shower for the head for 7 days. And warm water, don't go for sunlight, and don't go for rain or anything. And Patya Ahara and Lagu Ahara, these are you indicate in at home. It is one thing you can do early morning, so it will not affect your OPD treatment, OPD consultation. So it will be useful for them to come also early when they can go for a work also. Better to avoid work, you ask that even they can work also because they are in the office or anything, you can go for the work. School, children, after 12 years, you can do the treatment of Nasya. So, and also, Nasya process, you just give a simple, I will show you later, one big cloth covering the whole body and one rod you keep in front of that to hold it. Then you open, I think it will show later. Please show me. This 1 minute. Here, like this, you put a one rod. You can give a steam in the Nadi Sveda. Then it will be useful for one person can do Nasya. Though if there is no assistant, that you can do the Nasya also. There, one person can do Nasya, and after giving steaming, then drops up can be put. Nasya. So, and Bandhanas. This is very simple. Look for looking very simple, but very effective treatment. Many damages of the Bandhana is a very beautiful treatment. The Vatahara treatment, one of the Vatahara. So you can do Bandhana or Upanaha. Or in the evening, you go for rest. Next day, ask to remove. These are all the Bandhanas. I have done some Upana Sveda and Bandhanas also. Next. 1 minute. And Bandhana picture, you show the video. The video is there. See, Bandhana, it is Upana Sveda. Same way, Bandhana with the Pichu. You can do the, instead of Lepa, you can do some oil Pichu or any Kashaya Pichu also can be done. Some of Pichu you can do and tie it like this. Bandhanas in any joint, any shoulder joint pain, or most of the ankle sprains, bandhana can be provided in OP level. Like this, bandhanas can be done, say, bandhan. And as I told, Grivavasti, Janubasti, Kativasti, all these things, very simple process can be done in OP level. Evening, ask them to come. You do Janubasti, both Jana or single. There are pictures, I will show you the Janubasti picture. Let's see. This way, as I told you, to cut your one chocolate tin, you can cut like this and fill with the dough of the masha kalka, and 2 pieces extra you have to put here. Then it will be block the everything. So it is easy to do, very simple process. Good result will be there for Janu related problems. Yeah. Then same thing in the Kati Basti. For Kati Basti, you can use like that. Kati Basti, Kati Basti. Like this. Kati Basti can be done. This same Janu Basti can be useful for your Grivavasti. Is also Grivavasti can be done with this. But Grivavasti, you ask them to cut their hair, at least the part of which touches the birds. Otherwise, hair will leakage. In same Shirobasti in a paper, I will show the Shirobasti. In a paper, we first put one bandage with the Masha Kalka, one plant, then you put this one, then measure his head, and you stick the paper, then you put on the head, you can pour the oil on that. You can take long time also without leakage. You can do this is very nicely, this one, and good effect in the Shiro, especially migraine headache, very good result is there. Okay. Shirodhara. Shirodhara, simply you have to cover the eye with I told you can cover eye with this glass. So you can cover the eye. Then Dhara, one helper is needed. You just collect the oil and this is. So Shirobasti, Shirodhara can be done in the OPD level. This is Tarpana. Just Tarpana. Tarpana is simply you can do with this glass cutting because it is easy to clean, easy to maintenance, all this thing. You cut with this, make a drill of this one, you tight it. It will last 5 to 6 Tarpana, you can use one. Then it will be tight, then it will make start. So 5 to 6 Tarpana can be easily done with this. Just adjust its head with the, you need not to there this thing, you tie like this, then it will be very easy. Daily you can use. And use like a small spoon, you can pour inside the eye, and you can take it out with a syringe. New syringe, you take it, and after finishing, you can give the Duma. Duma is a Duma yantra. I showed extra like that. This Duma yantra, we have a small this thing, you can give the steam and heat it and lock it, and there is a hole is there to slowly you can push it with and then it will go very easily to the Duma. After woman and all, Duma yantra you can keep. If there is no Duma yantra, you can use Mastravasti tube. This tube, you can open it. You can open here and do Duma with this. Duma can be given with the Mastravasti tube also. If you don't have the water, okay? This all set. And Agni Karma, I told no, Agni Karma can be done in the only local cleaning the thing and heat it. The shalaka, you can put which point. It will giving in sometimes sciatica or Vridrasana very nicely. You will address temporary relief, not a permanent relief with the Agni Karma. You can temporary pain relief, you can do. But some of the ward, they can burn after that. Dogana, Apunarbhava with the Agni Karma, you can see. And Kshara Karma also same with you can apply the Kshara on the arshas and that. But you need for that some OT level treatment for the sterilization. Shujitva is an important factor among the Shodashakala. I mean, Chatushpada, the two qualities are repeated with the Shujitva for the doctor and Daksha for the doctor. That same thing is repeated for the Upacharika also. So these two, Shujitva is important while during all the treatment. Then patient will happy with where the Suchi is there, they will get very good relief. So Shujitva, especially for I told to Charakarma and Agni Karma also, or any Uttarabasti, any Chara Sutra, and all, it should be in a OT level treatment. It's good. And Abhyanga, it's a very common nowadays. The name of the Ayurvedic doctors, massaging doctors. Unfortunately, massage only they think is Ayurveda. Panchkarma, they don't know what about Panchkarma. They say, can you do the treatment on Saturday and Sunday? All Panchkarma can be done. These are the questions arises, and I am tired. Can you do a massage for one day? Don't do. This is not Ayurvedic doctor's duty. Your duty to Abhyanga is a nut process. Is the cosmic force should flow to the patient through you or through anybody is forcing. It should heal inside, not for any relaxation, or this is not our unfortunate thing. All the centers, if they are not getting patient, they will start Abhyanga as a treatment. And Steve, that is one day treatment. They get relaxed. They are very happy. This is not the treatment. That is not meant for Ayurvedic doctors. Please, I am saying the name of the Ayurveda is not. Just we have to explain them what is Ayurveda, what it is. The Ayurveda is science which is heals you. When after this treatment, you will feel, because I say when patient is bedridden, young man, make him to wake up to his duty. That's Ayurvedic doctor's duty. That is his food will come from his duty. So that must be done Ayurveda, not as a Abhyanga, as a what they say, where they are doing in the massage in the beach side. It is same to the Ayurveda doctors. So and in the name of Ayurvedic massage, don't do. Abhyanga is a process for your any Panchakarma is a Purva Karma of is a Abhyanga you have to do that one. And Tailadara, little difficulty to do in the OP level, but Tailadara is a good result, where the Tailadara at an excellent result we can get from the Tailadara. So Tailadara process I'll tell you later also. Upanahasveda, as I told Bandhana like Upanahasveda, Pichu can be Pichu is with Bandhana is good effective. You do the Pichu with some parts, whichever, if for the back you can do the Pichu. All Pichu, all and Pindasvedas, like
physical कैसा रहा?
Pardon? Namaste. Oh, sorry. Patrapinda Sveda. Patrapinda, where PPS we call as everything, that will be giving effect. That can be OPD level with one assistant. You can do same thing, Jambira Pinda Sveda or Valuka Sveda, and different Svedas can be done. And Svedana Yantra, if not there, I can give local Svedas. And if you want to give Basti, you can give just for Kati, Vankshana and all Nadi Sveda I can give. And Shirodhara, Matra Basti and Shiro Basti, we can give a OP level very easily we can do. Now we go for the difficult things.
अब कराया था टेस्ट.
Pardon? Oh, yes. No, okay. Continue next one. So complexly we have to do Vamana. Vamana is a process where needed a OP treatment with difficulty, but we can do with difficulty. Therapeutically target kapha disorders, and first Purva Karma, Abhyanga, Svedana can be done periodically as what they can do. On Vamana day, he asked them to previous day Utleshada Ahara, any Dadi Ahara or fish or any Tila. These are Utleshada Ahara, make very Utleshada Ahara. Ask him to come in the early morning, do again under Abhyanga and Sveda. Then give early morning. It can be done very simply at 6 or 7 o'clock. You can do the kapha time. It is removing. But here Vaidya Samuha 2-3 assistants needed. Not just one assistant is not enough. Somebody has to hold. Somebody has to not to bend, and sometimes they have to give Santwana for him. or any doctors with 1 or 2 doctors, an assistant doctor, then you can do this with this. Vamana can be done also, no problem. And Virechana, you can ask him to do it at home, but it's not so good. Ask him to stay one day at your hospital. If it is a one resting room, as you can Virechana giving process. Same way, Abhyanga, Svedana, Utleshara, you can give some Pitta Utleshara Ahara, and you can give little later. With the time you can give. Ask him to, in the clinical time, you come at 9 o'clock, 10 o'clock, you can give the Virechana. Ask him to observe on that day how many this Ati Yoga or anything is there, Damitya Yoga, and think. Just observe him and you can send home in the evening. That is Virechana. Niroha Basti, it's the easy process, but he has to stay up to the afternoon. We can give Niroha Basti. Normally, we are giving it later after Madhyana. We don't Vidyana. To 9 to 10 o'clock, we start Niroha Basti. Abhyanga Sveda is given that day, and after Niroha Basti preparations, I will show Niroha Basti one easily doing one. We have it is available in Kerala and all. Netra. Niroha Basti can Netra is there. So this, instead of Basti, we can take plastic pots and we can pull in the medicine with the Pura Pramana. You can take it like this. It is not what, no. There's a Basti Netra is there one, sorry. In the picture I show, is the Niroha Basti picture. See, here one Netra is here. Fill it, you can give it to the direct to the anus while giving. Here also, Vaidya Samoha is told. Basti, while Basti and Vamana need some Vaidyas extra. You need an assistant doctor with you, it is good. Or any internist, or you can bring them and teach them also. Is really the best treatment, the best result is giving by the Niroha Basti. Most of them giving Matra Basti, but Niroha Basti, their risky factor is there. But result factor is a beautiful result. Ardha Chikitsa, it is called really Ardha Chikitsa. You can practice Niroha Basti, then you will get beautiful result. I am so sure what in my hospital, most of the treatments are got by the relief from the Niroha Bastis. There are different Niroha Bastis, Yapana Basti, Picha Basti. All possible Bastis you can do in your OPD level also. But observe him up to the evening or afternoon, then send him. Careful after that Patya. Or Patya or what they should do, or Samshamana Chikitsas also. That they go after going eating a lot of chapati and all, then it will aggravate like anything. They might get a vomit, all these things. So ask him to peya with the ghee or any mamsarasa, they can eat it after the basti. No. And Shastika Shalipinda Sweda is also a little not complication. It can be done OP, but the cleaning process and preparation should be overnight. All the Kshira Kashaya made in the overnight, morning you can do. But I have seen in the morning, if it is winter, it is very cold and it will get chillness. Better to do in the evening is nice. Shastika Shali will be, result will be the good in the evening. It is a Santarpana Chikitsa actually. After my Panchkarma is first Deepana Pachana you have to give. Then you give the Purva Karma, Sneha Sweda. Then after that Pradhana Karma. After that, these are the Brahmana Chikitsas like Shastika Shali, Tailadhara you have to do. Then it's a one course of treatment will be altogether will be happening. Next one. Tailadhara. Let's show the picture. Tailadhara picture. This also gives good result. Patient will have inner cleaning after cleaning, or the nourishment is beautiful with the Tailadhara. The Tailadhara makes you the what told in Vata Vyadi. It can bend the casta can bend, the wooden can bend with oil, but body will be flexible, all the pains will go, they can, mobility will come, all these things, Teladara, it's a costliest treatment. There will be a lot of oil needed and patient should be effort to do that. Then if it is not effort, you do local Teladara also. That will be giving a lot of result, especially your Pada Kantaka or tennis elbow. You do Teladara, after that to give much result. So this we got a good result in Teladara. When patient is IP, that will be useful. They will have a good result in that. Okay. And Uttar Basti, we are not practiced because we are not studied well. So we are not practicing, but it is, I studied that it is needed in a OT or very hygienic way or sterilized way, need Shara Sutra and Uttar Basti. And other Pichu and what is that? Pichu can be done at home also. Pichu and Pindas Vedana can be done. So these are the Panchakarmas can be affordable in the all OPD level. Now, next is the stick patya. There is a managing OPD level after stick patya you should, and you have to tell if it is apatya, then what you did, everything is vina patya in Ayurveda Chikitsa is not so. Everybody asks what is diet, what is, then we have to give a list of chart for them to Paschat Karma, how to they have to protocols in the home, or how they have to not to go to sunlight, or we have told brahmacharya, everything should apply, explain them and tell that patya them. Then Vapad, any Vapad comes, we have to ask them to strictly watch them. You have to go to sometimes his home. It is not able to walk, and then you have to go to home and see the patient. If it's a from long patient, we can do in a nearby lodge. You take a room and patient coming from the distance place, you can ask them if there is no IPD facility, you can do. And Sadhya Sadhyata, this is important. You should see your name and fame depends upon Sadhya Sadhyata. You know, Sadhya and Krucha Sadhya can be different. Asadhya, you can try. Sorry, Krucha Sadhya, you can try. But Asadhya, we should refer him. Otherwise, we should say no. This we have to study in Ayurveda. Mostly the case will come after roaming every hospitals. They come to us where Asadhya case. Then you have to say no. There is no other alternative. We said so. No, the Sadhya Sadhyata will give your name or fame depends upon. Unless there is 80%, don't take the case. Maximum 50% below 50% result. If you have a confidence, then only take. Otherwise, don't take the case. No, if you say no, it is a very good. Doctor says no, it is they will respect the doctor because he directly said, I cannot cure this. You go somewhere. Don't take unnecessarily to your hospital. All negative will enter. You will get your name and fame will go. The sadhya is important. The most important thing, biomedical waste. Small government also doing so many acts in the biomedical waste. Panchakarma, we say we are in Ayurvedic, we don't have any wastages. Don't say, we Ayurveda have lot of waste. So waste management, we have to tie up with the any biomedical waste management. But even though there is our thing is fully oil waste will be there. And uh, plastics may be less, but lot of oil will be there. So I am seeking with the other doctors also, the oil management, oil waste management, what are they are doing? We are supposed to not to give to any, throw it out like that. In our waste management, the it goes to the plants and it will get the damage. We recycle it. Here we can first we can give some oils which is can be used by patient. They can give the oil. There are things you can apply for yourself. We can give some fluid as a villagers. They can take as a fluid and buffalo for the applying for the buffalo also. No, it is not contaminated so much. Then you can give to the buffalo. And recycling, there are soap factories under their sold. I don't find anything in as in rural area. And in I've seen SDM college, they are burning with the injecting to the fire. Then there such things can be developed in Ayurveda. Oil waste is a big wastage system is there. And biogas, I used a biogas. It's very useful in a biogas in a IP level that you can get at least 2 hour gas. with the biogas unit, you can get biogas unit. You put all the your sediments or dhanyamla or masha kalka. These are all can be recycled as a biogas. You can get hospital can be recycled with the biogas. These are the disposal method. All other things can be tie up with the companies. You can give something, but only they will not take the oil. They will say we cannot do something at all. So you can see some factories are there, they can use oil there. And such things, I am also seeking that what to do with the oils. Some of my friend in Vaidya Grama, they are using as a candles also. Candle also. That can be done, I think, in a large level. So these are the already. Now is the time for them. Now one just I will conclusion because sorry. Conclusion, I will tell to all my students, this is our treatment is not failure at all. This is a beautiful Ashtanga Sangra, Ashtanga they are told. Ashtanga Sangra, Kvachit Dharma, Kvachit Mitram, Kvachit Artha, Kvachit Yasha, Karma Vyasa Sthiti, Kvachit Chikitsa Nasti Nishpala. What I felt in Ayurveda, this is Kvachit Dharma. You can follow a beautiful Dharma because Ayurveda is a Dharma Shastra. It will give you how to treat with the poor people, how to treat with the people with able people like that. They have you can do what of dharma in this. Chikitsa dharma is beautifully done in this. Maitri, you can get Maitri from all over the world. There is my guests are there in the from the I think today guest is attended. My from all over world you can get the Kvachit Mitra because of Ayurveda only. Kvachit Artha, only Kvachit Artha. You don't need a Bharat Artha. Kvachit Artha you can get. And Kvachit Yasha. Even in a rural area, I am here in a small village. Yasha is there because of the Ayurveda. Karma Abhyasa. By experience, I can teach my students. I can tell some to do. You can practice like this. But nowadays, practice is changed. Totally changed what we are doing. All in online. There is no darshana, sparshana, prashna. The darshana, sparshana is not clear in the any online treatment. If you do the field touch of the patient, is really the energy passes from you to the cosmic to the patient. That we are doing. Chikitsa Nasti Nishpala. Never failure. Oh, my dear student, don't think Ayurveda will not give money, but it will give everything. So you be with Ayurveda, you practice Ayurveda, enjoy with the Shodhana and Shamana Chikitsa, you will succeed. All Ayurveda, what benefit gives, the ultimate Dharmartha Sukha Sadhanam is completely will get by the Ayurveda. This is my conclusion. Any mistakes, any by Ashastriya, if I told, excuse for that. And one more, I have to thanks all of the teamwork. It is not a one my team, my students, all RAV staffs, all this did for them. I thanks all and thanks all the gurus hearing this one, my thing, and all the blessing for the students. Have a good life in Ayurveda. Thank you very much. Namaste. Any questions can be.
Thank you so much, sir.
Okay.
Now, if anyone having any questions, you may please ask to sir.
डॉक्टर श्रीकांत जी, बहुत बधाई आपको। मैं उज्जैन
नमस्ते।
से वैद्य एस एन पांडे। आपका
हाँ,
मुझे
नमस्ते।
सबसे अच्छा वही लगा कि जो आपने
हाँ।
कहा कि मसाजर बन के हमको नहीं रहना है।
This not
वो सबसे
massage is
अच्छी
not Ayurveda.
हाँ नाटक तो वो,
Abhyanga is
लेकिन अभी होटल की जो परंपराएं चल रही है वो अपने बहुत सारे आयुर्वेद के क्लिनिक में भी चला रहे हैं। तो वो आपने बहुत अच्छा मैसेज दिया, मैं इसको अप्रिशिएट करता हूँ। और अब सभी छात्रों से भी निवेदन करें कि भाई कब अपन मना कर दें उनको कि भाई तुम होटल में करा लो और कहीं कराओ, लेकिन यहाँ तो सिर्फ चिकित्सा ही होगी। ये आपका संदेश बहुत अच्छा है और बहुत अच्छा लगा मुझे।
सुन से बहुत अंतर में बहुत संतोष होता है। हम आयुर्वेदिक डॉक्टर्स ड्यूटी इज नॉट ए मसाज, इज नॉट आयुर्वेदा ओनली। आयुर्वेद इज वन पार्ट ऑफ इट। थैंक यू वेरी मच। थैंक यू।
चिकित्सा, थैंक यू सर।
श्रीकांत जी, बहुत बहुत बधाई आपको, बहुत सुंदर व्याख्यान दिया आपने, बहुत बहुत बधाई आपको।
धन्यवाद। आपका नाम प्लीज? आपका नाम?
वैद्य चित्त कुमार त्रिपाठी, गुरु।
ये दिल्ली से है सर।